Hello, good day, everyone. Welcome to Garden of Fertility. Since this week, we have been talking about PCOS. So, I want to use the illustration to discuss more about it so that you will understand what the PCOS is all about. As you can see in this diagram here, this is a typical example of how this polycystic ovarian syndrome looks like. It's a disease of the ovary. Now, it is a hormonal disorder that is causing the ovary with small cysts on the outer edge. This is a common hormonal problem in a woman of childbearing age. As you can see in this illustration, when the ovary is normal, it will look like this. And when it's abnormal, it will to have bubbles like water in it. Women with polycystic ovarian syndrome may not ovulate because they normally have abnormal hormonal level. Now, what is the cause of this polycystic ovarian syndrome? No cause have been found to be the major cause of this ovarian disease. But there are some risk factors associated with polycystic ovarian syndrome, like type 2 diabetes, infertility, high cholesterol, elevated lipids, abnormal uterine bleeding, and high blood pressure. Some women also have obesity, depression, and anxiety. Some women struggle with physical symptoms of polycystic ovarian syndrome, like trouble in conception, mood change, acne. Maybe sometimes you see some women, their body is full of eczema, tiredness, high testosterone level, excessive body hair growth. You see some women that are having hairs like men in their jaw. This is a sign of polycystic ovarian syndrome. They have weight change and trouble in losing weight. They find it difficult in losing weight. Ovarian cyst, low sex drive, they don't have hunger for sex. And also irregular missed period. Their period are not regular, they always miss their period, and many more of them because different person with different symptoms. Talk with your healthcare provider about the best way to treat the symptoms that bothers you. In treatment, currently there is no cure for polycystic ovarian syndrome. Don't be surprised about that. For women who are not seeking to get pregnant, treatment will likely focus on correcting and harnessing their underlying hormonal balance. If you're not ready to produce or conceive, your focus should be in correcting your hormonal imbalance. Some people have been asking, can I get pregnant with polycystic ovarian syndrome? Yes. If you have polycystic ovarian syndrome, you need to have a moderate weight. Work on your weight. Balance your blood sugar level. Treat other polycystic syndrome with healthy lifestyle changes and medication. In some cases, fertility medication can help you get pregnant. If that doesn't work for you, you may need an IVF treatment without wasting much of your time. Meet your healthcare provider for recommendation of drugs. Avoid self-medication when it comes to polycystic ovarian syndrome. Finally, how do you know that your polycystic ovarian syndrome is getting better? Number one, your period will come back to normal. Two, you confirm your ovulation. You will see you'll be ovulating very well. And increased energy. You will also have a decreased craving, as in having hunger of eating much. Your skin will be improved, your hairs, losing of weight. Even if you're eating too much food, you'll be just normal. And finally, you get pregnant naturally. These are the signs to know that your polycystic ovarian syndrome is getting better. So if you are passing through such, please don't joke with your lifestyle, medication, your dieting. Make sure you maintain a healthy weight. It can help you a lot. So thank you for being part of this family. Please, if you find this section informative, please don't forget to like, share, recommend. There are a lot of people that need to hear this. It is possible to get pregnant with polycystic ovarian syndrome.